Unopened pens can be stored in the refrigerator until they expire by the date on the box. Open pens can be stored at room temperature. Open pens' expiration date varies by manufacturer. Always check to find out when your pen expires in case you haven't used all the insulin in the pen. Wash your hands with soap and water. Remove the cap on the pen. Examine the insulin. If your insulin is cloudy or has particles and it's not supposed to, do not use that pen. Remove the paper tab on the pen needle. Screw the pen needle onto the pen and turn it until it's on tightly, but not too tight. Always attach the needle before dialing the dose on the pen. After you've attached the needle, remove the outer cover. Keep this outer cover. It's how you will get the needle off the pen when you're done with it. Remove the inner cap and discard this needle protective cover. Dial the safety test dose of 2 units on the pen. Hold the pen with the needle pointing up. Push the injection button. Make sure insulin comes out of the pen needle and the window is back to 0. If you perform a safety test 3 times and no insulin comes out of the pen, change the needle. If it doesn't work on the 4th time, use another insulin pen. Never use your pen needles more than once. Dial the dose your doctor has prescribed for you. We are selecting 8 units for this demonstration. Remember, if you dial the wrong dose before you administer it, you can dial back or forward. However, you can't dial past the number of units in the pen. If your prescribed dose is higher than what the pen will allow you to dial, you may have to give your dose in 2 injections. Insulin can be injected into the abdomen, a finger's distance away from the belly button, upper outer thighs, hips, upper buttocks, lower back, or the upper outer arms. Always pick a different injection site each time. First, use an alcohol wipe to clean the injection site. Insert the needle straight into the skin and with the thumb, push the injection button all the way down to 0 and then count to 10. After 10 seconds, remove the needle. Place the outer needle cap on top of the needle. Twist it until the needle comes off the insulin pen. Used needles should always be placed in a hard plastic container with a lid or a sharps container. Use a new pen needle every time. Put the pen cap back on the insulin pen.